Hey everyone, Dr. Jake Filkins here again with Family Chiropractic and Wellness. And if you found this video, that means that you're struggling with headaches. And I want to talk to you, take a moment here to explain what is the most common thing that we see in our practice in regards to headaches. What is the biggest piece of the headache puzzle? And when we look at that, we look into the spine, and we're going to be talking about the vertebral subluxation complex. Long words to say misalignments that are occurring in the spine. When we look at our spine, it was built for two things. It houses or protects our nervous system, but it's also built for flexibility and movement. So if our spine isn't moving properly, our body isn't able to function properly. Our spine has three main regions. The upper part, our neck, is the cervical region. Then we have our thoracic region, which is our mid-back. And then our low back is the lumbar region. When it comes to headaches, we look specifically into the cervical region. And the reason why is because the information that's coming from our brain and going into that area is controlling our head movement. It's also controlling the sensation of what we can feel in the back of our head, into our skull, things of those nature. So if we look at our spine model that we can see here, this piece right here is where your skull is at, and you can see that we have all of these bones. In between each one of these bones, or vertebra, are these yellow nerves that we can see coming out. These represent our spinal nerves. Each one of these nerves are very, very important because they control something specifically. There is nothing that happens in our body with our brain, without our brain saying so, that brings it down to a nerve. That nerve brings that information to the proper portion of the body. Headaches specifically are C1, C2, the top two bones of the vertebral bodies of the spine here. So we're looking at these spinal nerves. Why that's so crucial is because these nerves are carrying all the sensation that we can feel back here, and it's also controlling a little bit how our neck is moving. If we have compression, if something's squeezing on one of these nerves here, that's going to cause dysfunction. It's not going to function the way that it properly should be. I like to use the example of a safety pin. When we look at how that should work, it should be a completed circle, correct? Our brain is up top. It sends information down our body. It says, body, do something. Our body performs that act. Information comes back. Brain says, well done. Well, if that safety pin is unclasped, if it's not connected, brain sends information down, our body performs an act, but our brain isn't getting that information back saying, good job. Also, in that same exact example, it could be that our body is saying, hey, we need help with this, but our brain can't get that information. Either way, what can be the result is pain, but what always is the result is dysfunction. And it doesn't take a lot of pressure. When those joints, when those vertebral segments we were talking about get misaligned or subluxated, it's like squeezing on those nerves, like I mentioned earlier. Studies show that the weight of about a nickel, about 5 grams, is all it takes to have nerve disruption, meaning that information cycle isn't functioning the way that it should be. What we have to do is we have to restore that. So we have to remove all that interference, remove that pressure on the nerves, so that way brain can tell the body what to do, and the body can bring that information right back to the brain, and things can function properly. If we have this imbalance in every part of our cervical spine, the most common, not always, but the most common symptom that we see are headaches and migraines, and that's why we always look to that area when people come out to our office with those complaints. If you're struggling with headaches, guys, I hope that you got some information from this video. Have a fantastic day. I look forward to seeing you all on the next video as we continue to talk about headaches and things that help with that. Enjoy your day.